So this is how to relieve hip and knee pain using foot reflexology techniques. So it's going to be on this outer lateral aspect of the foot. And you could see there's kind of a protrusion here. This is the base of the fifth metatarsal, okay? So you could easily find that. That's one of your markers. Your other marker is this heel bone. This is a calcaneus. And you're going to want to find the top. That's your other marker. So between here and here is this kind of little triangle-like area. Around here is housed the reflexes to the hips and a little bit to the knees. If you start to move above, you'll start to get into the arm reflexes and other reflexes. So we're going to be really concentrated in here. We're also going to do some work from out here. There are some sciatic and hip reflexes that also course through here. So for this place between here and here, I'm going to use thumb walking. So with thumb walking, again, you're just doing this, walking and bending this joint here. You're going to come down here. You're just going to get up a little bit and then come back down. You're not going to pop out. You're going to go in with continued pressure. You're just going to go in again and in again. There we go. And we could also do a little bit of that press and slide, which Dr. Manzanares does. You press in and you could kind of slide into that area. Press and then slide into the area. When you work this outer area, you'll also use thumb walking, but you'll come across out through here. So you're supporting the foot with this hand. I'll kind of lift it up so you can see it a little bit better. It's going to be all through here. So you start here, you just come down, and it can be really intense as well, especially for women. And so interact with your person, and if they let you know that it's too deep, just ease up a little bit on. Okay, you come down through here and come back and then meet that point through here. And again, you could even just do like a point pressure. You could just press in. And you'll feel it. You might feel a little bit of a change in the tissue texture in that area, which I feel here, and you'll just want to give that a little bit more pressure. And then when you let go, just ease up. And of course, you'll want to do both sides. If for some reason someone is experiencing hip pain, you don't want to necessarily only just do the side that they're experiencing it on. You want to do both. Just because the pain might be on the right side, for instance, doesn't necessarily mean that it's not coming from the other side. In addition, you could add a little bit of lower back reflexes and lymphatic groin around here with your finger walking technique. And also the heel of the foot, you can thumb walk. I like to thumb walk side. And that'll also give attention to that area. It's kind of doing the hips, the knees, the whole pelvic region, and then you can also do a little bit of the lower back through here with your thumb walking, just so that you're giving attention to the whole area. And that's thumb walking, finger walking, and reflexology for the hip and knee area.